Hi, my name is Dr. Jane Robertson, Director of Medical Affairs at IDEXX. The International Renal Interest Society, or IRIS, has recently added the SDMA kidney biomarker into their guidelines on how to diagnose, stage, and treat chronic kidney disease, or CKD. This video will focus on the IRIS recommendations for diagnosing CKD and how the IDEXX SDMA test can be helpful. CKD is an irreversible disease that is diagnosed based on evaluation of all available clinical and diagnostic information in a stable patient. Let's review the clinical presentation of the patient with CKD. It's important to consider the age, sex, predispositions, and relevant historical information, including medication history, toxin exposure, and diet. Younger animals, for example, may be more likely to present with an inheritable disease or intoxication. Keep in mind that in early CKD, animals can be asymptomatic. Clinical signs worsen as CKD progresses. Common clinical signs include polyuria and polydipsia, weight loss, decreased appetite, lethargy, dehydration, vomiting, and bad breath. The physical examination may also be normal in pets with early CKD, as abnormalities become more apparent as the disease progresses. Common physical examination findings include palpable kidney abnormalities such as small irregular kidneys, evidence of weight loss, dehydration, pale mucous membranes suggestive of an underlying anemia, uremic ulcers, and evidence of hypertension, for example, retinal hemorrhages and/or detachment on fundic exam. Historically, diagnosing early kidney disease prior to the dog or cat developing clinical signs and overt azotemia has been challenging. However, as more pets have preventive care or wellness blood work performed, we can detect CKD earlier. In addition, at IDEXX reference laboratories, SDMA has been added to all routine chemistry panels. According to the IRIS guidelines, to diagnose early CKD, one or more of the following findings could be present. Number 1, the creatinine is increasing within the reference interval. Keep in mind, the best reference interval is a pet's own normal baseline creatinine established during health. Number 2, a persistently increased SDMA. SDMA increases when there is on average 40% loss of kidney function and as little as 25% loss compared to creatinine, which doesn't increase until up to 75% loss of kidney function. Number 3, abnormalities are found on kidney imaging, on abdominal radiographs and/or ultrasound. And lastly, number 4, persistent renal proteinuria has been confirmed. When diagnosing more advanced CKD, there will likely be more apparent clinical signs and physical examination findings that support kidney disease. For advanced CKD, the IRIS guidelines state that the pet must have persistently increased creatinine and SDMA concentrations, as well as an inappropriate urine-specific gravity, which is considered to be less than 1030 in a dog and 1035 in a cat. Gone are the days that we don't consider kidney disease until the urine is very dilute or isotoniuric. Once a pet has been diagnosed with CKD, the next step is to stage the CKD. For more information and to learn more about staging and treating CKD, please watch the other videos on the IRIS CKD guidelines.